With our athletes that we treat, we have about a nanosecond to treat them. They want to be cured yesterday. So I'm going to show you now a tool called PEMF. It's P, E, pulsed electric magnetic field. These packets of energy come in pulses, just like an MRI when you hear that tick, tick, tick. Now, how did we discover PEMF? How did it all come about? Well, let's look at how magnetic fields work. One of the key observations was by Sir Isaac Newton. Remember when an apple fell? That's about the time we have that apple falling from the tree to get an athlete better, because if we don't get them better soon, they're off to the next doctor, right? So we apply that discovery that he had with the heavenly bodies and the earth and gravitational pull to a therapeutic modality, pulsed electric magnetic fields. So it turns out force equals the G constant, the gravitational pull, with the inverse square, Newton's inverse square law of the radius. So the further we get from the source of what we're treating, it's going to go down by an inverse square proportion. So the closer we get this magnetic field, and I've drawn a PEMF unit, looks just like an MRI. There's copper wire in plastic housing, just like an MRI unit. But in this case, we're not producing an image. We're producing a magnetic field that will influence the tissue and the cells. So what this is going to do to the cell membrane, which is very active, cells have sodium and potassium. So these Na has a charge, and potassium has a charge, it turns out. So what they are doing is they're donating a packet of energy, an electron, which will in turn open up the cell membrane so that helper cells surrounding the cell can get into the cell and repair the cell. Kind of like photosynthesis for plants. We use a packet of the sun's energy to help the growth and natural life cycle of a plant. And in the same way, we can influence nerve, we can influence bone, because guess what? When we break a bone, all right, here's a bone, and we have a little break in it. Bones have calcium, which also has a charge. So when we apply the PEMF unit to that, we can use that energy uptick to help excite those calcium channels which run through the bone, the Havration canals, remember those? And that will help stimulate bone healing at a faster rate. So, what are we talking about faster rate? Well, let's talk maybe 2 to 3 times the normal rate. So for that athlete that was waiting 5 weeks and just slogging along, now maybe we're taking it down to 2.5 weeks instead of the normal 5 to 6 weeks for normal bone healing. And that's assuming that they don't have any risk factors like osteoporosis, or they're not being compliant about wearing their cast or offloading. So this becomes an invaluable tool to making your practice better and making your patients and your athletes more satisfied, because we're getting them back in the game sooner. So another thing to remember about PEMF is it's different than your cell phone. It's much safer. Our cell phone is transmitting energy at a constant continuous rate. It's open electromagnetic field. PEMF is in pulses, hence packets. So it turns out when we have pulses, it's much safer. You've heard the talk about not putting the cell phone up to your ear because people are worried about brain cancer. We don't have to have those same types of concerns with PEMF, because even though much higher Gauss, which is the level of energy, or Tesla, the power, the only thing we have to be concerned about is the biologic frequencies, because if we get up into biologic frequencies greater than 60 to 80 hertz, if we get up to frequencies greater than 60 to 80 hertz, that could potentially cause free radical damage in the cells that might lead to damage down the line. So as long as we know the operating space that we're in for safe levels, we can safely deliver pulsed electric magnetic fields to help cure our athletes.